Hello, people amazing. How are you doing? Good morning, good afternoon, good evening, good everything. Wherever you are on the planet at this point in time, hearing my voice, how are you doing? How's your day been? Yes, we are back to that place where the Word Cafe Live show, where we come in to lean on one another's experience and, build and receive energy to, walk into that future. Yes, you're wondering, what are we going to be talking about today? I have somebody. I'm so glad. Don't worry, I will say more about that person very soon. I call her a medical hero. You'll get to know why I call her that very soon. Her name is Adaeze Odili Oreh. Yes, you heard that name. And what are we going to be talking about today? Don't worry, when I bring her in, you would know why I call her the medical hero. Where is she? You're wondering. In a bit, she'll be with us now. Blah, yeah, there she is. Hi, Ada. Good evening.
Good evening,
How are you?
Amakri. I'm good. I'm good. And I'm pretty
Wha-
excited and honored that you called me to join you on Word Cafe today.
No, the excitement is just mine. As in, when I checked you up on LinkedIn, where did I see that? I saw something about you, and I read it. I was like, "Excuse me, is that the same Adaeze I know?" So I read about. I just went through it quickly. I said, "Wow, it's been like how many years?" And I just said, "No,
Hmm.
I need to bring her on the show to come and share with my audience and the world this wonderful thing she's been doing." Welcome. Thank you for the for answering this call. So, who is Adaeze Oreh?
um, First of all, you know a bit about me, so let me just, in a nutshell, I'm a mother, I'm a wife, and I professionally am a consultant family physician and currently country head of planning, research, and statistics with Nigeria's National Blood Service Commission. I also double as a senior health policy advisor at the Federal Ministry of Health, and
Hmm,
I'm a member of the governing council of Nigeria's first private medical university, the PAMO University of Medical Sciences.
hmm.
So I've worked across public and private health sectors for the past 18 years.
Wow.
And my work currently involves working with policymakers at both the ministerial and the sub-ministerial levels to develop and implement policies that reduce maternal and child deaths and reduce the spread of infectious diseases like HIV, hepatitis,
Hmm,
and improve the distribution of safely screened blood to hard to reach communities, and especially those in our setting in Nigeria that are in remote and conflict affected places.
wow.
Between 2009 and 2014, I was coordinating a US government and federal government of Nigeria project for blood services. And that was kind of my entry point into blood
Hmm,
services at the policy level, not
okay.
no longer as a hospital doctor.
Hmm,
And I was covering Abuja, Niger, and Nasarawa states for
okay.
that project. And it involved working with the Federal Ministry of Health, the US CDC, the Centers for
Okay.
Disease Control and Prevention, USAID, the US Agency for International Development.
Hmm,
And basically, what we're trying to do, and of course, it was funded by the United States President's Fund for AIDS Relief, PEPFAR.
okay. All right.
So what we're trying to do was institute a system, a formal blood transfusion system for the
All
country.
right.
And my role was critical to national policy formulation, managing information, supervising the operations, quality assurance, and basically emergency preparedness and response. And so
This
when
is this. Go on. Go
so
on. Go on.
I tend to talk on, but why I wanted to highlight this was we know that about a decade ago we started having like terror in Nigeria,
Yeah.
with Boko Haram and all that.
Hmm,
And when the United Nations office was um, affected by bomb blast in
yeah.
2011, we were critical to the emergency response and provided hundreds of units of blood that was used to save the lives of those who survived that bomb blast. So that's one of the
Whoa.
memorable impacts of the work that we've been doing over the years in
Awesome.
blood.
When you were talking, I was trying to marry the Adaeze of, you understand what I mean by that?
Of
Looking back from
1990
yesterday, of 1990.
in my
I mean,
pinafore,
you were not
in my blue pinafore.
exactly blue pinafore. Back then in school, you were not a science inclined person. If I mean, correct me if I'm wrong. I know you were into literature,
I love
English, and all that.
literature.
And all of
Yeah,
us, yeah. And all of that, I know you made one of the best. I know. Remember then in school,
yeah.
in our set, you made one of the best when it came to literature. And like she's in medicine now. How did you discover this part of you? Tell me, how did you?
Well, so the thing is, I always loved biology, and
Okay.
so I mean, throughout secondary school, I loved biology, I loved literature, I loved English, and so basically, I was trying to be strategic. I was torn between
Mm,
a career in law and a career in medicine. And as you know,
yeah,
both my parents are in law and medicine. So it
exactly.
was basically, and they had zero inputs into what I wanted to do. It was, you tell us what you want to do at the end of the day. So I wanted to be smart. So I did my courses that would have allowed me to study law and the courses that would have allowed me to study medicine. So I made sure I did my chemistry and physics, even
Mm,
though I was
yeah.
those were my favorite courses, but I made sure that I did good in them so that if I came to that decision of going into the sciences, then I would be comfortable. But basically, my driving force has been helping people. So whether it was in law or whether it was in medicine, that
Mm-hmm,
was going to be the push.
mm-hmm.
How to get to improve the lives of people. And so by the
Okay.
time we're writing SSC, I had decided that I would go for medicine because at that point you now have to take JAMB, right? So there's no
Yeah.
straddling the decision making at that point. So I I
True.
opted I opted for medicine by SS3, and
Okay.
so that is how I got into studying medicine at the College of Medicine in UNN, University of Nigeria in
Yeah.
Nsukka.
Yeah.
And while I was there as a medical student, I was like, oh my goodness, I'm going to be this hotshot cardiologist. I'm going to be in heart medicine. And that's where I
Yeah.
saw myself. But by the time I did one full year of clinical rotations, I could see the problems with
Yeah.
healthcare access in terms of the divide between
Okay.
rich and poor, urban and rural, and the health
Mm-hmm.
system gaps, financing, organization. And so I knew that even though I had this keen interest in a clinical subspecialty, I felt that
Yeah.
um, I would have more to contribute by going into health systems policy for building and strengthening Nigeria's health system for equitable healthcare delivery. And so by the time I was graduating, I knew that that's where I was going to go, health systems management. And I had a couple of people say, "Oh, you're wasting your brain." And that's
Mm.
why I bring it up, because I don't think there's any area of professional life that's a waste of anyone's brain.
True.
And regardless of what it may seem like to you, the onlooker, whatever
Yeah.
pushes someone into a particular field i-
Mm.
is most likely a calling. And there's a
Okay.
reason why they've been called into that area. So whether you think only those who have IQs of a certain number should go into certain
Mm-hmm.
areas, I mean,
Mm-hmm.
the maker knows why he calls people into certain areas. And you see people with incredible IQs and they're in music, they're in art.
Mm.
There's a
Mm.
reason why they're there. And so I don't think there's any sector that is a waste of anyone's capacity. And so that's how I got into public health and
Okay.
health systems. Yeah.
Wonderful. Now, somebody listening to you now will say, okay, Auntie Ada, you've been in this area for this long. You've built capacity, you've built competence and all that. How did it all begin for you? What were your challenges? How did you find your rhythm? Because the way you're speaking now is like you were born speaking this way, you were born formulating policies this way, but obviously you had your challenges here and there. So, how did it all start for you?
I would say for me, I would describe it as a case of passion and preparedness meeting opportunity. And
Mm,
so when so I completed my house job, which I did at the Braithwaite Memorial Specialist Hospital in Port Harcourt,
in
now the
Port Harcourt, yeah,
State University Teaching Hospital.
yeah,
And right after that, I did my youth service, and then I went for a master's in international health management.
mm,
So at that point, you see, my choice at that point tells you I knew I was going into health systems management, right? So
true.
I had a mindset. My master's was at Imperial College in the UK.
All right.
So there was that option of remaining in the UK. By the time we were finishing my class, we had recruiters who were coming to Imperial College to recruit. We had they would have receptions for us, they
Mm,
pitching their companies, pitching
exactly.
um jobs that they wanted us to actively apply and interview for. And I would tell friends that I would just go there, drink their orange juice or drink their champagne and chat with them and leave. I never applied for
Ali.
any positions there because I knew that I wanted to come back to Nigeria and work in the public service. And so I already had that mindset. But then I came back, immediately submitted my applications um,
Mm,
at the Public Service Commission, where if you want to go into the federal public service, that's the
sector.
route you go.
Yeah.
And there were no vacancies available. And so months would pass. I was following up literally weekly, and there was
Mm,
nothing. And then after a couple of months, I was like, I can't just be sitting around. I started doing some, like you said, I have some creative aspect to me.
exactly.
So I was
Yeah.
doing some interior design and all that, basically to
Mm-hmm,
keep busy. And then I
mm-hmm.
volunteered my services with the Federal Ministry of Health. And I
Oh,
was volunteering with them for 7 months at least.
wow.
And so going out on healthcare delivery programs, initiatives, workshops,
Mm.
seminars, I was fully engaged. And even the interior hustle kind of downscaled because I was so committed to this volunteering that I was
The
doing.
volunteering, yeah. Okay.
But what it did for me was that it helped me build networks in the sphere that I wanted to work. So
Awesome. Awesome.
I started getting engaged with people who were key players in the sector. So I
Mm-hmm.
knew who was doing
Yeah.
what, which unit or department was responsible for what, and it also positioned me to be in a place where when the US government and the federal government were
Mm.
setting up this project, I was in prime position to hear about it and go for the
Wow.
interview. And I
Wow.
heard about it purely by chance, just being in an office and hearing that those interviews were going on. And I hightailed it to the location of the interviews.
Wow.
So,
Go on.
sometimes so it sounds crazy, but that's basically what happened. It's like, oh, you didn't know about these interviews, fine, but are you ready to go and work as I think they were looking for a data officer at the time,
Okay. Yeah.
somebody to manage the information systems,
Yeah.
and that was the vacancy available. And I said, data is not my favorite area. And I keep saying this even to people that I met. I'm like, this if this is something that I'm going to do daily, well, I mean, I would rather be working in disease control and but that's what's available. I'm going to go and interview. And I think it took me about 30 minutes to get to the venue. I was sweating, my
Okay.
shirt was soaked, and they asked me to wait, and then I went in for the interview. And by the time I finished, they said they would get back to me.
Yeah.
And I got a call later that evening from someone who, in the course of my volunteering, I had also gone on blood drives and
Okay.
advocacy with them. So you see what the volunteering had done for me. These are people who I wouldn't have known.
Exactly.
And she asked me and said, would you be willing to coordinate a relatively new project?
Yeah, like a pilot.
And I was like, excuse me, I came for technical data officer, I'm not sure. And she said, because that opening had literally just come up. So
Okay.
they weren't even interviewing for it. But by the time I did the interview, they said, this person sounds like she would be a good fit for this role. We can always find
Mm,
somebody else to do data.
mm, mm.
And that's how I got that project coordinator role.
You know,
And
listening to you now, one thing should I say, a takeaway from what you just said now is volunteering, mindset change. You didn't just sit down there and say, okay, it will fall on my laps or something. You went for it, not minding the level or the qualification or whatever. You just like, that's where my heart is. No matter how low it is, I know I can build something from that position. And you just went out there. And in course of your volunteering, is like, you've put yourself out there, and one or two people have seen your interest and your passion, your drive for this. It's like, okay, she has this passion for something like this, and boom, another opportunity came up, which
exactly,
invariably was higher than the data management, whatever. I mean, a good number of us young people out there, we get, I mean, they're taken aback, like, this is not what I want. If I don't get what I want,
yeah.
that will happen or that will not happen. But excuse me, why not go for that little thing? Build capacity over time. You said you were volunteering for 7 months. Technically, I would say that was like a year or so you were
Yeah.
volunteering. So imagine putting that on your CV. I've been doing volunteering job for 7 months, and you have a testimonial to back that up. Beautiful. Now, you've been here for 17 years plus. You know, what do you think we need to know about this blood advocacy? Because, you know, a good number of us in this country, in Nigeria, in Africa, but West Africa, but Nigeria to be precise, when you talk about blood, we always have this phobia. We don't trust it. Are you sure? So, what do we need to know about it?
So the first thing that we need to know about blood services and blood safety is that Nigeria happens to be one of the countries that has a high burden for conditions that require the availability of safe blood.
Whoa.
That's one. So when I talk about conditions, we have one of the world's highest death rates for women in pregnancy and childbirth. Nigeria alone contributes almost a quarter of the deaths recorded around the world in pregnancy and childbirth.
Are you
And a lot
serious?
of and a lot of that is from bleeding and lack of ready access of safe blood.
Wow.
Then we have literally the world's highest burden for malaria. And why a lot of children die from malaria is the fact that when they have severe malaria, they are very anemic, they have very low blood levels, and they
Mhm.
require safe blood to get them out of that critical state.
Whoa.
Then again, Nigeria is one of the highest burden countries for sickle cell disease. And a major component of the management and treatment of sickle cell disease is availability of blood for when they're the survivors are in crisis and
Hmm.
require blood to get them out of that severe anemic state. Then we have a very high burden of road traffic accidents. A lot of the times, I mean, if you speak to even the Federal Road Safety, they'll say to you, one of the pressing things in their job description is getting accident victims to places where they can receive safe blood in a timely manner. So just from these few examples, of course, we can go further, talk about cancer, talk about routine surgical procedures that require safe blood. Then compare it with our population. We have a population of over 200 million people. 50% or more, in fact, more than 50%, more than 60% of our population are actually within the age bracket of blood donation, as in people who should be eligible to donate blood. So you see that there's a huge gap and there's a disconnect between the need for blood and the awareness of our population about what we can do in terms of donating blood regularly to save the lives of people who need them. So this leaves a lot of work for us to do in terms of advocacy, working with communities to educate and sensitize about the role that individual members of the population can play in building our voluntary blood donor base in the country.
That's huge. I mean, you have a huge tax in your hands. I mean, I don't envy you for that.
You can say that again.
Listening to you now and hearing the statistics being rolled out there, a good number of us don't know this. We really don't know this, but I mean, we have a better by this now we have a better understanding that whoa, there's a lot to be done. Now, I read something recently. Something happened recently. I read, you made a statement, and I was so proud and happy about that. During the Omicron sting, when they placed some sanctions about ban, Nigeria and South Africa. I remember reading a report when you came out strong to speak like you can't just single out Nigeria or Africa and place a ban, on us, all in the name of the Omicron variant of the COVID-19, the COVID-19 virus. I beg your pardon. Yes.
Yeah.
And I was like, wow, that is Adaeze speaking. What really prompted you to go that route, make that statement?
Frustration. It was my response and the response of some other colleagues was born out of frustration. The science shows that the world is in a place where we have person-to-person transmission. We live in a globally connected world. There is no way a variant of the virus will exist in one place and we can be 100% certain that it's not in another place. So singling out certain countries because of the identification of a particular variant is wrong, and it's not backed by the science in any way. It just reflected how in times of crisis and in times of uncertainty, humans can just fall back on age-old biases, unfortunately. And that's what we saw, and we felt the need to speak out against it because it didn't have any value or any promise as a way of curbing the spread of the Omicron variant. And if you followed, a couple of weeks later, some of those policies were reversed because there was no benefit to having those bans on certain countries. The response, hitting back on the policy to ban certain African countries, I mean, Nigeria, South Africa, several other, in fact, not just African countries, let me put it, low and middle income countries, because of the Omicron variant, was wrong. It wasn't backed by science.
Yeah.
There was no scientific basis to that policy. We're in the world at the moment, people are transmitting the COVID virus from person to person, regardless of the variant. So we are in a globally connected world. What that means is that any variant anywhere in the world just has several hours to be in another place. So it's not about banning. It's about emphasizing what those preventive measures are to keep populations safe.
Yeah.
And if you like, a couple of weeks after that policy, they had to
Awesome.
reverse those policies because people spoke out. They were wrong. I know some people said, oh, always calling out the
Yeah.
race card, always calling out the victim card. But we
Mm.
should be able to speak out against what is wrong and what is not
Mm.
backed by science. That's why you have scientists. That's why you have that role that people who have studied science and epidemiology have a role to play and a contribution during a
Mm-hmm.
time like now when we're in a
Mm-hmm.
pandemic. And so it was
I
unfortunate
must tell
that
you, when I no, go on,
it's
go on. Sorry,
unfortunate
go on.
that when you have a crisis situation like this, people tend to fall back on age-old biases, and that is exactly what happened. People
Mm-hmm.
were just falling back on, oh my goodness, it's their disease. You can't label COVID-19 as anyone's disease. It's wrong ab initio, and even now you shouldn't even do that because the COVID-19 it's everywhere and people are spreading
Mm-hmm.
it and the world is globally connected. So we should look for ways to safeguard our populations instead of alienating
Exactly.
ourselves.
What's your next action? What are you up to? Any project? What are you up to?
Well, for now, I'm literally consumed with increasing Nigeria's voluntary blood donation base. I'm invested in communicating and working across sectors with different agencies, both in the private and the public sector, to sensitize and educate our people on the need for safe blood and the role that we as individuals, families, and communities can play to contribute to the safe blood base in the country. In terms of the future, since I don't have that unique gift of predicting the future, I would just say that wherever there's work to be done in contributing to nation building through health and development, you can be sure to see me there, especially if
Wonderful.
it will involve working to close gaps in equity and in access, because I believe that every single one of us deserves health and access to the social determinants of health, meaning education, a safe, clean environment, all those determinants of health. I believe that every single person should have access regardless of where they are born, regardless of the language they speak, regardless of what they do and the religion that they practice. And so that's all I'll say about where you'll see me in future.
Awesome. Wonderful. Guys, we've been having a wonderful discussion with Adaeze Odili Oreh, not minding the network issues we've been having. I call her a medical hero. She has enlightened us on so many. I use the word so many, yes, carefully, on so many, should I say, points with regards to blood donation and health policies within our country as a nation and yes, the world at large. It's been a wonderful, wonderful time. Yes, with all the internet hitches here and there, but honestly, we're having a swell time. So before I let her go, because we've been here for a while now, not minding the challenge, what do you have to tell my audience? One last word from you, Ada, before we, shut it down for the day. One last word from you.
I will say, I won't use one word. So I'll just say we should be committed to being diligent, consistent, and delivering excellently, no matter the sector we are. We have to be intentional. And by being diligent and consistent, you will definitely open yourself up for opportunities that will forge long-term alliances that could build up your profile and give you the opportunity to contribute positively to nation, region building, and global impact. But the key to this is being aware of ourselves, knowing our limitations, and working and applying ourselves to improving both our knowledge and our skills so that we can add value. And as Kofi
Wonderful.
Annan said, I admire him a lot. Knowledge is power, and
Mhm,
power is liberating. And
mhm,
education is the premise of progress in every society and in every
mhm.
family. So
Awesome.
let's aim for that.
Oh, thank you so much. Guys, I wish I can continue this conversation with Ada, but time is not our friend and the internet is playing some games on us. But I know she's going to answer our call next time when we call her on the show, to talk more about what she's doing and the progress and all of that. I just want to say a very big thank you to Ada. Thank you for being there. Thank you for listening. Thank you, everybody. We will be back. And you know the way we say it on the show, till we come your way again. My name is Amakri. Amakri is Soboye. I believe in the power of words. Why? It is the unit of creation. Bye for now. Thank you.
Thank you so much, Amakri.